pé ọ̀rọ̀ yìí ó sì ń pa àwọn èèyàn ó dẹ̀ sì ń sọ ilé tó dùn ó sì ń sọ di ó sì ń yọ adùn yẹn kúrò ń bẹ̀ ó tún lè cause a heart disease brain kidney ẹjọ́ nítorí ọlọ́run gbà táwọn ilé bá ṣẹlẹ̀ síyàn kí ló tún kù ọlọ́run jẹ́ ká rí kò ṣe déédé we will shred this issue and ensure that you understand everything about hypertension by the time I'm back from this short musical break. Don't forget, it's Radio Clinic on Wells Radio 89.3 FM. I am Kemisola Williams.
Without doctor's prescription, call on doctor's attention if you need solution. Too much is given, much is expected. Just give much is live long and stay strong. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ẹ̀fọn tó gbòòrò àtò lọ́wọ́ àwọn tó rẹ̀rọ. Kẹ́kùn lè gbà kó sàbùn tókò. Cleanliness is essential. Immortalize your potential. Understand the times and your initial.
Ìmọ́tótó borí àrùn gbogbo. Once you put the measures, everything into place, then the next one is you pray. And by the time you do that, you're good and you're fit and you notice that you've been able to prevent or to cover your families, cover your loved ones, put them aside from any form of ailment. Don't forget, it's in 2 stages, like I mentioned it. Welcome back to Radio Clinic on Wells Radio 89.3 FM. I am Kemisola Williams, and with how I started the show, I informed you that today we will be discussing hypertension, a very serious medical condition that we need to, take cognizance of. These we can't jettison is if there's an estimation, if there's a record of 1.28 billion adults that are, struggling with this worldwide. And I believe it's what we must look into. Àtúntún padà dé ẹ̀yin èèyàn wa láti wá sọ̀rọ̀ nípa common ailments tó jẹ́ wípé ẹ mọ̀ bí mo ṣe kà á lẹ́ẹ̀kan. According to World Health Organization, wọ́n sọ wípé èèyàn kan nínú èèyàn mẹ́rin nínú àwọn ọkùnrin àbí èèyàn kan nínú èèyàn márùn-ún ìyẹn obìnrin kò sí ni ẹ máa rí ẹni tó ní hypertension. Ẹ̀dẹ̀ wá fẹ́ béèrè pé why tó ṣe rí bẹ́ẹ̀, ìdí tó ṣe ń rí bẹ́ẹ̀ àti nǹkan tẹ́ lè ṣe tó jẹ́ wípé ní fi jẹ́ victim of hypertension. Gbogbo ẹ̀ pátá òun ni a máa ṣàlàyé lónìí. I have my guest in the house, and my guest is Mrs. Ibukunlanre, a registered nurse midwife, and she has been practicing for 5 years now. She works with a mental health organization in the United Kingdom, and she is a mental health practitioner. Good evening, ma. Hello. All right. Thank you for joining us on Radio Clinic today. Hello.
Hello, I'm here. Good
Yes,
evening,
yes.
Miss Kevin.
Thank you so much, Mrs. Ibukunlanre. And it's a privilege having you, and I appreciate that. Getting you from UK is not a small business. But by the time I started working on hypertension, Ejeriru, I just decided that it's not a section that I can leave out, because I have people too who are victim of this, and I know how it went. In short, that's my dad, my late dad. So I don't want anyone to be a victim. I got my enlightenment by a little, but I know with you here, you will really help us. All right, let's start with, we do it in
Yes.
Yoruba. Ìyẹn fún àwọn èèyàn wa tó jẹ́ wípé Yorùbá ni wọ́n yàn láàyò. Ẹ bá wa ṣàlàyé lédè òyìnbó, ẹ tún ṣàlàyé náà ní èdè Yorùbá bí a ṣe máa ń ṣe lórí ìlera lórí afẹ́fẹ́ radio clinic nìyẹn. Ẹ jẹ́ ká bẹ̀rẹ̀ pẹ̀lú definition. Let's start with the definition of hypertension, this ailment that is popularly known as high blood pressure. We start with the English section now.
Okay. All right. Thank you, Miss Kemisola, for having me on the program. I'm so privileged to be here, and I'm happy and excited to enlighten people more about what hypertension is, the causes, the complication, and the prevention and management. I'm so happy, that hypertension is a major point of discussion today.
Yeah.
As you have said earlier, that hypertension is one of the leading cause of death in Nigeria and is a major risk factor of cardiovascular disease, which are a significant cause of mortality in the country. In Nigeria, is a significant cause of death
Yes.
in adults in Nigeria, and we know that about 22 to 44% of people living in Nigeria suffer from hypertension. So I'm so happy it's our topic of discussion for today. So hypertension is generally known or commonly known as high blood pressure. And as it sounds, high blood pressure, it is a condition where the force of the blood against the walls of the artery is consistently high. Like, I would like to expatiate that definition by explaining heart and the blood vessels, like the function of the heart. As we all know, the heart is an organ that is responsible for pumping blood in our body, and the blood vessels are like pipes that carries this blood, that circulates the blood around our body. So hypertension majorly deals with the heart and the blood vessels. So the force at which the heart is pumping blood is very high, and that is why we come about the hypertension, where the force of blood against the blood vessels is always high. That is what hypertension is. Thank you.
Oh, thank you so much, Mrs. Ibukun. Now, before we begin to dig into, because I am very sure that people want to know the symptoms, the causes, the effect, prevention measures, and other questions that is very, very pertinent that we just have to talk about it to enlighten people today. Let's discuss the types. The types, and as well, I want you to help me shed light to these. We are that the types of hypertension, high blood pressure, and the categories of hypertension.
Okay. All right. Thank you very much. Blood pressure, like this hypertension, like we initially said, that is the force at which the blood is pumping against the wall of the arteries. So there is a level at which the blood needs to pump. The heart needs to pump the blood, which will give us the normal reading of 120 over 180. Tó túmọ̀ sí pé bí ó ṣe yẹ kí ẹ̀jẹ̀ wa, agbára tó yẹ kí ẹ̀jẹ̀ wa àti wa máa lò láti máa fi pump blood sí àgọ́ ara wa, kò yẹ kágbára yẹn ju 120 over 180 fún most adults. But we have different body system, and our body composition is different from others. So what is normal for me may not be normal for you. So òun la ṣe máa ń rí variations, and you need to know your baseline before you can say this is my normal blood pressure. But according to WHO, the normal blood pressure reading for most adults should be 120/80 millimeter mercury. So this takes us to stages and categories of hypertension. We have about 4 stages of and categories of hypertension. We have elevated hypertension. Elevated blood pressure is when the reading is about 120 to 129 millimeter mercury. You know, I said initially that the normal reading is 120/80. But see, once the 120 is now exceeding 120 and it's going beyond 120, like 121, 122, that means it is elevated. We are not categorizing it as hypertension. We are not saying it's an hypertension or stage 1 hypertension. That is just elevated. It is high. So we go to stage 1, which is stage 1 hypertension, and that is when your blood pressure exceeds 120 and it is going to 130 to 180 systolic. And over 80 to 89 millimeter mercury. So we go to stage 2, which is 140/90 millimeter mercury. That is when the blood pressure is reading 140 or above to 90. And there is then something we call hypertensive crisis, which requires immediate medical attention. And that is when the blood pressure is above 180/120. It needs medical attention. Once your blood pressure is above 180 and the diastolic is 120, this is hypertensive crisis and it can lead to major complications.
Ẹ ṣé gan ma, ẹ ṣé àlejò wa Mrs. Ìbùkún. Ẹ jẹ́ kí a wá mú ní Yorùbá definition hypertension àti types of high blood pressure tí ẹ ṣàlàyé. Ẹ nísìn fún àwọn èèyàn wa tí wọ́n darapọ̀ mọ́ wa, à ń sọ̀rọ̀ nípa hypertension. Okay, all right, please kindly give me some. All right, so a fẹ́ sọ̀rọ̀ nípa à ń sọ̀rọ̀ nípa hypertension. A máa ṣàlàyé lóyìnbó àti ní Yorùbá. A dẹ̀ máa mú ní ọ̀nà méjì fún gbogbo èèyàn, àti ọkùnrin àti obìnrin, àgbàlagbà ni, ọmọ kékeré ni, bó ṣe lè ṣẹlẹ̀ òun la máa ṣàlàyé. A máa kọ́kọ́ ṣàlàyé ẹ̀, àwa ṣàlàyé ti ẹni tí ó yẹ pé ó di oyún, àmì ó di ọwọ́, ó di ẹsẹ̀ sínú tó lóyún, so that a lè mọ̀ bó ṣe ń lọ pé bẹ́lẹ̀ yìí o ló ṣe yẹ kí health mi ṣe rí. If you are pregnant, àbí ẹ ti ń rí àwọn signs kan, that's when we get to the symptoms. So ń ṣe máa ṣàlàyé hypertension fún wa ní èdè Yorùbá àti the types.
Okay, ẹ ṣé olóòtú. Hypertension ní èdè Yorùbá jẹ́ nǹkan tí a mọ̀ sí ẹ̀jẹ̀ ríru. And ẹ̀jẹ̀ ríru yìí jẹ́ nǹkan tó máa ń fa ìlera ọkàn, like heart disease, tó máa ń fa ìlera ọkàn, tí ó dẹ̀ tún lè ṣokùnfà àwọn ìjàmbá míì nínú ara. Ó dẹ̀ jẹ́ pé ó jẹ́ nǹkan tó wọ́pọ̀ láàrin àwa ọmọ Nàìjíríà. Ó dẹ̀ tún jẹ́ nǹkan tí a kì í tètè fi ọkàn sí. So ẹ̀jẹ̀ ríru yìí, ìtumọ̀ ẹ̀ ní pé bí ọkàn wa tó jẹ́ heart tó ṣe ń ti ẹ̀jẹ̀ jáde sínú àgọ́ ara wa kò tí ní normal level tó yẹ kó tì, ó ń lo agbára láti tì. Agbára tó dẹ̀ fi ń tì yìí ó máa ń ṣokùnfà kí heart tó jẹ́ ọkàn wa yẹn kó rẹ̀, kó dẹ̀ wà thickened, kó má ní agbára láti ṣe iṣẹ́ yẹn dáadáa mọ́. Tó bá ti ń ṣe iṣẹ́ yẹn dáadáa, ó máa dé stage kan tó yẹ pé ó máa rẹ̀, kò ní lè ṣe dáadáa mọ́. Àtàwọn blood vessels wọ̀nyẹn náà tó jẹ́ pé àwọn ló ń gbé ẹ̀jẹ̀ káàkiri àgọ́ ara wa, àwọn náà wọn ò ní lè ṣe iṣẹ́ agbára yẹn mọ́. Òun ló wá ń fa oògùn sí ẹ̀jẹ̀ ríru tí blood pressure bá ṣe ń lọ sókè, torí àti wá fẹ́ máa make sure pé òun ń ṣiṣẹ́ ẹ̀jẹ̀ tó ń wọnú àgọ́ ara wa, ṣùgbọ́n kò ní agbára yẹn mọ́. So ó máa ṣe ní ìṣẹ́jú ju bó ṣe yẹ kó lọ. Òun ló máa ń jẹ́ kí ẹ̀jẹ̀ ríru ṣẹlẹ̀. Then a tún sọ̀rọ̀ nípa kí ló yẹ kí ìfúnpá mi jẹ́. Okay, mo lọ sí hospital, a máa ń pè nǹkan ní normal blood pressure pé blood pressure mi o oye tó yẹ kó jẹ́ normally òun la máa ń pè ní 120/1/80 millimeter mercury nǹkan tó yẹ kí normal blood pressure adult kò jẹ́ nìyẹn ṣùgbọ́n torí pé àgọ́ ara mi yàtọ̀ sí àgọ́ ara sista Kemi tí sista Kemi náà dẹ̀ yàtọ̀ sí ti èèyàn míì gbogbo wa yàtọ̀ síra body composition wa yàtọ̀ síra so variations wà orú ti tèmi ó lè jẹ́ bíi 90/80 ìyẹn ò túmọ̀ sí pé ó lóòjù fẹ́mi torí nǹkan tèmi jẹ́ nìyẹn but tèèyàn míì dẹ̀ lè jẹ́ bíi 160 tèèyàn míì lè jẹ́ so olúkálùkù ní normal baseline ní tiwọn ìyẹn la dẹ̀ máa ń work towards ká máa fi mọ̀ bóyá ẹni yìí blood pressure yẹn normal àbí bóyá blood pressure yẹn kò normal so ṣùgbọ́n eléyìí táwọn wa sọ fún wa WHO wa sọ fún wa pé okay o eléyìí ni ká wá fi ṣe base ká fi ṣe like parameter ká fi ṣe gauge pé eléyìí tó bá ti wá wà within 120/180 o normal so ìyẹn la máa ń pè ní normal reading fún àwọn àgbàlagbà so a wá rí ìpele kàtígórì ìpele ẹ̀jẹ̀ ríru tó bá ti kọjá 120 tó ti ń bọ́ sí 121 títí dé 129 ìyẹn la máa ń sọ pé ó kàn lọ sókè ìyẹn ò túmọ̀ pé bóyá èèyàn ní àìsàn yẹn lára.
Okay.
So elevated la máa ń pè yẹn ìkejì ní stage 1 hypertension ìyẹn ni pé ìfúnpá yẹn ti ń wọ 130 to 138 ìyẹn ni pé ó ti ń lọ sókè ju normal then stage 2 ni pé ìfúnpá yẹn ti ń wọ 140 bí mo ṣe ń sọ yìí náà over parameter kan náà ni o like tá bá máa sọ̀rọ̀ blood pressure a máa sọ̀rọ̀ pé 120/80 120 yẹn ni systolic over 80 yẹn ni diastolic so méjèèjì ni a máa wò pọ̀ tí a máa wá fi mọ̀ pé ìfúnpá ẹni yìí ti ga ìfúnpá ẹni yìí ó normal so méjèèjì yẹn ó gbọ́dọ̀ wà ń bẹ̀ so stage 1 tí mo sọ yẹn tòkè yẹn tó bá ti lè kọjá 130 títí dé 138 nítòkè títí ìsàlẹ̀ tí wọ́n ń kọjá 80 lọ sí 89 òun ni stage 1 hypertension stage 2 ni pé 140 lọ sókè tí ìsàlẹ̀ wá jẹ́ 90 náà tó ti ń lọ sókè ìyẹn ni stage 2 ṣùgbọ́n wá ní nǹkan tá a bá ń pè ní hypertensive crisis tó jẹ́ pé blood pressure yẹn tókè ó ti skyrocket ó ti lọ sókè ó ti di 180 tìsàlẹ̀ yẹn ti wá wọ 120 ìyẹn ni hypertensive crisis ó dẹ̀ túmọ̀ wípé àgọ́ ara wa nídìí àmójútó ó nídìí medical attention ká gbéra ká máa lọ sí hospital ní kọ́mọ́kọ́mọ́ ìyẹn ni categories of hypertension so a tún wá ní nǹkan tá a tún pè ní types of hypertension so types of hypertension yóò pín sí ọ̀nà méjì a rí primary hypertension yìí ló common jù ó dẹ̀ máa ń develop ó máa ń wá ní díẹ̀ bí ó rí di 110 lénìí 110/70 bí ọ̀sẹ̀ kan sí àbọ̀sẹ̀ méjì ó ti ń wọ 120 by the time tá tún máa fi wò ó ti ń wọ 130 ó máa lọ sókè díẹ̀ ni so it develops gradually kò dẹ̀ kí ń ní cause àkímọ̀ nǹkan tó ń fà á òun ní identifiable cause so ti primary nìyẹn ti secondary wa jẹ́ eléyìí tó jẹ́ pé bí èèyàn yẹn ní àìsàn sára tẹ́lẹ̀ àìsàn yẹn ló wá ṣokùnfà hypertension sínú àgọ́ ara èèyàn àbí bí olóògùn kan tí dókítà fúnyàn kéèyàn máa lò àbí bóyá àgbo yẹn ló wá ṣokùnfà kí ìfúnpá èèyàn máa lọ sí òkè ìyẹn là ń pè ní secondary hypertension those are the two types of hypertension.
All right. Thank you so much, our nurse midwife Ibukun. Yeah, for people that just joined the show, this is Radio Clinic on Wales Radio 89.3 FM. You prefer to some radio. I am Kemisola Williams, and our guest today on the show is Mrs. Ibukun Lanre, a registered nurse midwife for 5 years now. She works with a mental health organization in the United Kingdom. She is a mental health practitioner. We move to the causes now. Getting we will discuss the symptoms. We will move to the adverse effects as well. However, you hear people say it's because maybe village people, and everybody just don't want to believe or just want to accept that it's because of a way of life. We know some are hereditary. However, it's more than that. And with the information we read from World Health Organization, I believe people will get to know, especially when you are getting it from an expert, that there are ways of life or there are things that you can be open to that can cause hypertension. So that's what we discuss now. By the time we resume back from the musical break, don't go away. It's Radio Clinic on West Radio 89.3 FM.
Ribi nice, àtìké wọn araba mi.
You wanna live long, you wanna stay strong. You wanna live long and stay strong.
Ọlọ́run ọba tí mo
Ogun bílẹ̀ afúnni ni wọ́n sọ, olóyún abẹ́rẹ́, láì ṣiṣẹ́ abẹ, ewé ń jẹ́, ogun ń jẹ́.
kábíyèsí o.
Má ṣe lògùn without doctor's prescription. Mo ń tẹnu mọ́.
Don't use drug without healthcare professionals. Ensure that you get the directive. We've discussed that on the show, and I believe by now you would have stopped that way of life. Or maybe someone, a neighbor or family member, informing you that, okay, you can get this. No, that's not really proper. It's not. So kindly get to your healthcare provider, get the drugs use it as the healthcare professional prescribed. That's the best way. So with that, I welcome you back again to Radio Clinic on Wales Radio 89.3 FM, your preferred awesome radio. Ẹ káàbọ̀ padà sórí ètò ìlera lórí afẹ́fẹ́. Orúkọ tèmi ni Kemisola Williams. Lénìí, topic tí à ń treat, tí à ń yànnàná, tá à ń tanná sí, tá fẹ́ kí gbogbo ayé kó mọ̀ nípa ẹ̀, so that 1.28 billion yẹn a lè reduce drastically ẹ̀yin àti èmi. Àní jẹ́ ẹni tí ó jẹ́ pé victim hypertension tí àwọn èèyàn dẹ̀ tún mọ̀ sí high blood pressure. Òun ni a fi mú topic yìí lénìí. And before we add the short breather, I gave the information that we discussed the causes. A lot of things, especially at this side of the world, everybody attributes anything. Once it's negative, you hear it's from a village people. Please leave village people. They are minding their business. Let's put the proper measure in place. And how can you do that? Is getting knowledge. And that is why Wales Radio 89.3 FM brings Health Show to your doorstep every Wednesday, once it's 4 p.m. All you need to do is just to turn on and let's settle to get the knowledge. Let's move away from being ignorant, because by the time you get to the hospital, it will not be a portion. But the disease, this is what I will always say. I would love to always inform people, especially for people that just joined the show for the first time, that the disease won't tell you, I don't know, you are ignorant of this. You are not aware. Yes, let me use it that way. That you are not aware that something is happening, or you are not aware you shouldn't smoke. You are not aware you shouldn't drink, because all these things, sometimes we tend to say that when you drink too much. But don't forget that the accumulation of drinking and accumulation of smoking, either you do too much or not, will definitely make you to be a victim of a particular ailment or the other. And don't forget that all these ailments will not come alone. They come with, what I mean is that by the time one is there, then you are down with another one. If care is not taken, then the health system keeps breaking down, accommodating one ailment or the other. Àwọn nǹkan tí mo ṣàlàyé ní èdè òyìnbó ni wípé ẹ jọ̀ọ́ ẹ jẹ́ ká rí wípé à ń pàdé ní every Wednesday ní ìkànnì Wells Radio 89.3 FM níbi tá a ti ń sọ̀rọ̀ nípa ìlera lórí afẹ́fẹ́. Nígbà tí mo kà á tí mo rí pé 1.28 billion people ló ń du ẹ̀mí wọn sìn, tó ń du ara wọn lórí ọ̀rọ̀ hypertension yẹn tí a mọ̀ sí high blood pressure. Mo rí wípé nǹkan tí a gbúdọ̀ sọ̀rọ̀ nípa ẹ gbúdọ̀ mọ̀ nípa ẹ̀, and most times ẹ lè má rí bí ìwé tẹ́ǹká lè má sọ̀rọ̀ nípa ẹ̀, àmọ́ mo máa rọ̀ yín wípé every Wednesday tó wá ti lè dáago 4 bẹ́lẹ̀ lórí ìkànnì West Radio 89.3 FM, your family radio, your number one family radio. Kẹ́jẹ́ kí a fi ṣe ọjọ́ ìpàdé tí gbogbo àti ẹbí àti ìyá àtọmọ àti ojúlùmọ̀ tá máa rí wípé a pàdé lórí ètò radio clinic tí Kemisola Williams tí mo ṣe atọ́kùn ẹ̀. So my guest, thank you for staying on, and we discussed the causes of hypertension, also known as high blood pressure. Over to you, ma.
Okay, thank you, Miss Kemi. Talking about causes of hypertension, we've got modifiable risk factors, like risk factors. Like I earlier said, that there is a type of hypertension that has no identifiable cause. That is the primary hypertension. And we've got one which is secondary hypertension, which is as a result of underlying medical condition. So going to the causes of hypertension now, we will actually call it the risk factor, things that can prone one to have hypertension, which is the number one is I'm going to talk about is diet, the type of food we eat. A diet that contains too much salt can actually lead to hypertension, or eating too much of saturated fat can lead to hypertension. Also, weight gain, excessive weight gain, which is obesity, can lead to hypertension. Smoking, alcohol, consuming excessive alcohol can lead to hypertension, and physical inactivity, not participating in regular exercises can lead to hypertension. Also, stress, putting a very high workload on ourselves or too much workload on ourselves and not having the time to rest can actually lead to hypertension, can actually lead to temporary increase in our blood pressure. And also, age, the more we grow, the more stressful life becomes, like you trying to cater for family, responsibility increases. This can actually increase our blood pressure. Then family history, probably our father, our mother, great-grandfather has it. We should be conscious. We should monitor our blood pressure. We might actually come down with blood pressure since it's in the family, it's genetic. And also race. There are some certain races like that are prone to hypertension, having hypertension, which is African, is one of them. So that's the ethnicity I'm talking about, can actually prone us to having hypertension. Also, having underlying medical condition, having some medical condition like diabetes, chronic kidney disease can actually make us have hypertension. And some medications too, like these herbs that we take, some medication can also cause hypertension. So these are the risk factors. These are the things that can actually cause hypertension.
All right, thank you so much. For people that joined the show, this is Radio Clinic on Wells Radio 89.3 FM. And my guest today is Mrs. Ibukunlanre, a registered nurse midwife for 5 years now. She works with a mental health organization in the United Kingdom. She is a mental health practitioner. Àmàwá sọ̀rọ̀ ní aṣọ courses yẹn sìn, aṣọ ní Yorùbá. So tá bá ti sọ̀rọ̀ courses yẹn sìn ní Yorùbá, ẹ mọ̀ pé section tá wà ní fún everybody. Ìwọ ọkùnrin ni o, obìnrin ni o. Àwa move sí a máa sọ̀rọ̀ nípa symptoms yẹn náà. However, during my study mo rí wípé àwọn symptoms yẹn náà jọra. A máa move sí for pregnant women, àwọn tí ó jẹ́ wípé wọ́n ní oyún because of the time. Alright, ẹ jẹ́ ká sáré mu ní Yorùbá nǹkan tí ó máa ń fa hypertension.
Okay, ẹ ṣé olóòtú. Yeah, gẹ́gẹ́ bí mo ṣe sọ lédè Gẹ̀ẹ́sì, ká wá mu ní èdè Yorùbá. A ní láti bójútó oúnjẹ tí à ń jẹ. Oúnjẹ tí à ń jẹ, a ní láti wo iyọ̀ tó wà nínú oúnjẹ tí à ń jẹ àti irú ọ̀rá bí tí à ń jẹ, bí àwọn ẹran lọ́ra, àwọn nǹkan bẹ́ẹ̀ yẹn tí à ń jẹ, a ní láti bójútó. Then ká kàn jókòó sójú kan, ká má rìn kiri, ká má ṣe exercise, ká jókòó sójú kan, ó lè ṣokùnfà ẹ̀jẹ̀ ríru. Also, stress, ká má sinmi náà, ó tún lè fa lẹ́yìn ìgbà tá a bá ṣiṣẹ́ alágbára, ká má sinmi, ká má sùn dáadáa, ó lè fa hypertension. Then obesity, ká máa watch weight wa. Àwọn nǹkan bí eléyìí máa ṣokùnfà hypertension. Then àwọn tó ń fa sìgá, tó ń mu ọtí, àwọn nǹkan bẹ́ẹ̀ yẹn ó ń ṣokùnfà hypertension. Àwọn oògùn tí à ń lò náà ó lè fa hypertension. Oògùn tí à ń lò ó lè oògùn tí à ń lò àti àwọn medical conditions tí a bá ní, bóyá èèyàn tó ní diabetes tẹ́lẹ̀, tó ní ìtọ̀ ṣúgà, ìtọ̀ ṣúgà yẹn lè ṣokùnfà hypertension náà. So then ọjọ́ orí wa bí a ṣe ń dàgbà sí, òun náà ni ẹ̀yà ara wa ń dàgbà sí. So nǹkan bẹ́ẹ̀ yẹn lè ṣokùnfà, bá ṣe ń dàgbà sí, ó lè ṣokùnfà hypertension. Tá bá ti pé ọmọ ọdún 40 báyìí, a ní láti ká máa lọ sí hospital fún regular check-up. Àwọn stress tá à ń go through ó ń pọ̀ sí. Then ẹ̀yà ara wa náà ó ń rẹ̀ wọ́n díẹ̀ sí. Then èèyàn tó bá ní family history, tó bá yẹ pé bàbá, ìyá, ẹ̀gbọ́n, family nínú ìdílé ibi tí à ń gbé ó ní, a ní láti ṣọ́ra náà, ká máa yẹ ara wa wò ní déédéé, ó lè ṣokùnfà káni náà. Ẹ ṣé.
Thank you so much. So now we move to the second segment that has been designed for pregnant women. You know, when you talk about pregnancy, pregnant women, it's a special section. That 9 months is not a joke. You want to ask me if I've had one? I haven't. However, I've had people around me. I remembered when I have to sleep in the hospital for close to 2 weeks, 3 weeks, because we are moving, as in the person, the victim was moving from one situation to another. And I could remember that hypertension is part of the cause of why I have to be in the hospital for 3 weeks. Yeah, that's not really good. Okay, we move to that now. Let's discuss the situation of hypertension in pregnant women.
Yeah, thank you. Hypertension in pregnancy is also known as hypertensive disorder of pregnancy. So if we bring about 10 pregnant women together, 1 out of that 10 women will have hypertension.
That's serious.
That's the estimate. Yes, 1 out of 10 women. And this can lead to various complications in pregnancy. So gẹ́gẹ́ bí mo ṣe sọ lédè Gẹ̀ẹ́sì ni pé hypertension in pregnancy yẹn òun la máa ń pè ní hypertensive disorder nígbà tí èèyàn bá ní oyún. Pé tá bá dẹ̀ kó èèyàn 10 aláboyún 10 jọ, ìkan nínú àwọn aláboyún yẹn ó máa ní hypertension nígbà tí èèyàn bá lóyún. So èèyàn kan nínú wọn ó máa ní hypertension. And hypertension in pregnancy yìí ó lè lead sí various complications, serious medical health issues. So òun ló ṣe yẹ ká tètè kíra mọ́ ní ìgbà tí kò tí kọjá
full blown. Yes.
Bẹ́ẹ̀ni.
All right. Oh, thank you so much. Màá tún béèrè ìbéèrè yìí. I want you to help me ascertain these facts. Is it the same causes that we have in the general? How how someone can be down with hypertension? Is it the same thing with pregnant women?
No, I will say no.
Okay, all right.
Because in pregnancy, we can classify hypertension into 3 categories.
Okay.
Like the first one is chronic hypertension. Each category is actually defines what hypertension means in pregnancy. So the first one is chronic hypertension. Chronic hypertension occurs when a woman has a high blood pressure. The woman has a high blood pressure. Then she now becomes pregnant. And she already has that illness. She already has the high blood pressure. Or this blood pressure now she has a normal blood pressure, but it now become high within 20 weeks of pregnancy. Like it became high within 20 weeks of pregnancy. Yeah, that is chronic hypertension. Chronic hypertension, when a woman has the pregnancy already, then she now decides to get pregnant, or when she notices that her blood pressure is high within the first 20 weeks of pregnancy. So gestational hypertension is when the blood pressure is high after 20 weeks of pregnancy in a woman who had previously no history of hypertension. So that is gestational hypertension. This hypertension is now coming up, is now developing after 20 weeks of pregnancy. After she notices, after her pregnancy is going to five months, she is now noticing that she's having high blood pressure. And she has never had it before in her life. So that is gestational hypertension. Then we have another one called preeclampsia. Preeclampsia is the same thing as gestational hypertension, but with another condition. The condition of proteinuria, like there is presence of protein in our urine. So that is preeclampsia. Then we have another one that is preeclampsia superimposed on chronic hypertension. That's the fourth one. Preeclampsia superimposed on chronic hypertension. So this is when someone who has chronic hypertension, the first one I defined is chronic hypertension. So I said chronic hypertension is when the woman has a high blood pressure before pregnancy. It is not as a result of the pregnancy. She has it before pregnancy. She now decided to get pregnant. But after getting pregnant, she's now seeing proteinuria, protein in her urine. That is preeclampsia superimposed on chronic hypertension. Those are the 4 classification of hypertension.
All right,
Thank
you so much. This is very, very serious. Seriously. Please pardon me. I have a question in mind from the first section we concluded recently, that the symptoms, or maybe should I just ask together, what are the symptoms of hypertension, high blood pressure?
Okay. All right, thank you.
Okay, before you answer this question, ẹ má jẹ́ kí ká má sọ Yorùbá, torí àwọn èèyàn wa tó jẹ́ wípé Yorùbá ni wọ́n yàn láàyò, ẹ bá wa sọ ní Yorùbá. Àwọn categories tẹ explain wọ̀nyẹn àti hypertension ni. Okay.
Bí mo ṣe sọ, category high blood pressure nínú oyún ó pín sí ọ̀nà mẹ́rin. Ṣé mọ̀ pé ní ti àwọn tí ò lóyún a pín sí ọ̀nà méjì. A ní primary, a dẹ̀ ní secondary. Ṣùgbọ́n ní ti aláboyún ọ̀nà mẹ́rin ni. Ọ̀nà mẹ́rin yẹn tàkọ́kọ́ ni pé chronic hypertension. Chronic hypertension yẹn ni pé ẹni yẹn ó ní hypertension kó tó wá ní òun fẹ́ ní oyún. So ó ti ní hypertension yẹn, ó ṣẹ̀fẹ̀ wá ní oyún, ó wá ní oyún mọ́ hypertension yẹn. Àbí bóyá hypertension yẹn ó wá yọjú kí oyún ẹ̀ tó pé oṣù 5, hypertension yẹn yọjú. So possibly kó ti ní tẹ́lẹ̀ kó má mọ̀ pé òun ní pé ó yọjú within 20 weeks yẹn. So chronic hypertension ni pé ẹni yẹn ó ti ní hypertension, ó ti mọ̀ pé mo ní hypertension, ó dẹ̀ lè má mọ̀ pé òun ní hypertension ṣùgbọ́n tó wá lóyún mọ́. But a tún wá nìkan ìkejì tó jẹ́ gestational hypertension. Eléyìí la máa ń sọ pé oyún ló fà á kí ìfúnpá ẹ̀ ga sí òkè. So eléyìí a máa ń sọ pé àwọn èèyàn máa ń ní after 20 weeks tí èèyàn bá ní oyún. Ẹnìyàn ò ní hypertension tẹ́lẹ̀ o, ṣùgbọ́n ìgbà tó wá ní oyún tóyún ẹ̀ ti ń lọ tó ti pé oṣù 5 ló wá rí pé ìfúnpá òun ga no wá ní ó ní hypertension, that is gestational hypertension. Then
That's
àwa ní nǹkan tá à ń pè ní preeclampsia. Preeclampsia yẹn ni pé bí mo ṣe sọ nípa gestational yẹn, ẹni yẹn ò ní tẹ́lẹ̀, kò ní hypertension tẹ́lẹ̀, ṣùgbọ́n ìgbà tó bá ní oyún, tóyún yẹn ti wá ń kọjá, tó ti ń pé oṣù 5, náà wá sọ fún yín pé ìfúnpá ẹ̀ lọ sókè o. Lẹ́yìn ìfapá tó lọ sókè yẹn, wọ́n tún wá ṣe àyẹ̀wò, wọ́n tún wá rí pé protein ó wà nínú ìtọ̀ ẹ̀, ìyẹn ló máa classify ẹ̀ as preeclampsia. Then a tún wá ní ìkẹ́rin tó ń jẹ́ preeclampsia superimposed on chronic hypertension. Ìyẹn ni pé èèyàn tí ó ní hypertension tẹ́lẹ̀ tó ṣẹ̀ wá ní oyún, tá tún wá rí protein nínú ìtọ̀ ẹ̀, ìyẹn ni preeclampsia superimposed on chronic hypertension. So ọ̀nà mẹ́rin tó pín sí nìyẹn.
Ẹ ṣé gan. Seriously, it's a serious issue that pregnant women should be aware of. For people that just joined the show, this is Radio Clinic on Wales Radio 89.3 FM, your preferred of some radio. I am Kemisola Williams, and today we are discussing high blood pressure, hypertension. Ẹ̀yin èèyàn wa, mo mọ̀ pé a ti gbọ́. Ẹ̀dẹ̀ rí pé nǹkan tó jẹ́ pé a gbọ́dọ̀ mọ̀ nípa ẹ̀ ni. Fún àwọn tó jẹ́ pé wọ́n ṣẹ̀ṣẹ̀ darapọ̀ mọ́ wa, ìlera lórí afẹ́fẹ́ ni ètò tó ń bá afẹ́fẹ́ ṣọ̀rẹ́ lórí ìkànnì Wales Radio 89.3 FM. Adé ń sọ̀rọ̀ nípa high blood pressure, ìyẹn tó jẹ́ ẹ̀jẹ̀ ríru ní èdè Yorùbá. Mo fẹ́ béèrè ìbéèrè tí mo fẹ́ béèrè tẹ́lẹ̀, tí mo sọ wípé kán kọ́ yànnàná títí ọ̀rọ̀ categories àti high blood pressure ní ara ẹni tó bá yẹ pé ó ní oyún. Nǹkan tí mo fẹ́ béèrè sí, mo fẹ́ kẹ́ bá mi kó méjèèjì papọ̀. Mo notice pé àsọ ní ìgbà tá a kọ́ sọ ti general wípé kí ni àwọn symptoms tábẹ̀ sì máa rí bí akẹ́kọ̀ọ́ kọ́kọ́ mú tó wáyé pé kò wà papọ̀, because ìgbà tí mo kà mo rí pé àwọn kọ̀ọ̀kan jọra ń bẹ̀, àwọn tí ò dẹ̀ jọra ń bẹ̀ náà ẹ jọ̀ọ́ ẹ bá wa ṣàlàyé àwọn nǹkan tí a máa rí nínú ẹni tó jẹ́ wípé lára ẹni tó jẹ́ wípé ó ti ní àìsàn high blood pressure, ẹ̀jẹ̀ ríru, someone that is struggling or that is a victim of hypertension. What are the symptoms in people, and I mean both men and women, adults or general, and for pregnant women as well?
Thank you very much, Miss Kemi. The sign and symptoms of hypertension include severe headaches, chest pain, dizziness, Masabe Soni Yoruba, kí orí máa fọ́ wa ní ìgbà lóòrèkóòrè, all the time, kí a máa ní ẹ̀fọ́rí, kí àyà máa dùnyàn, chest pain kó máa dùnyàn. A lè má kọbi ara sí torí pé a máa ní orí fífọ́ ni, jẹ́ kí n kàn tí n bá sinmi díẹ̀ ó máa lọ. Àbí ká ní chest pain ká má kọbi ara sí, ká máa ní bí àmì ò jẹun tó ni. Àbí kójú máa kóyàn, kójú máa kóyàn ká wá ní pé bí ó fẹ́ ní bá ní, ká má kọbi ara sí pé ó lè jẹ́ hypertension. These are the signs and symptoms. Severe headache, like I had earlier said, chest pain, dizziness, difficulty in breathing, nausea and feeling like you want to throw up, blood vision or visual changes, anxiety. Kí n sáré sọ yẹn ní Yorùbá, kẹ́mi wa má balẹ̀ dáadáa, kó yí ojú máa kó wa, kó dàbẹ́ ni pé inú wa ó ń ṣe bẹ́ẹ̀ ni pé a fẹ́ kínú wa dàrú, kínú wa dàrú, kí vision wa má clear, ká máa rí méjì àti kó yí ojú máa kóyàn. Then ìyẹn ní general people tó jẹ́ pé aláboyún náà ó lè rí. This is peculiar to everybody, but if a pregnant woman, it's the symptoms with pregnant women is almost the same thing, but we have some changes, like some additional symptoms, additional ones, like swelling of the legs, the feet, the hands, the face. That is water retention. A máa rí pé ara wa ń wú, especially ẹsẹ̀. Aláboyún ẹ máa rí pé ẹsẹ̀ aláboyún wú, tá bá tẹ ẹsẹ̀ yẹn ó máa lọlẹ̀ gan ni, kó tó padà sókè ó máa pẹ́. So ara ti aláboyún nìyẹn. A dẹ̀ máa rí pé ìfúnpá wa máa wá lọ sókè náà gẹ́gẹ́ bí mo ṣe sọ. Tá a bá lọ sí hospital, wọ́n máa sọ pé ìfúnpá wa lọ sókè. Then tó bá tún ṣe àyẹ̀wò ìtọ̀, wọ́n máa sọ fún wa pé protein ó wà nínú ìtọ̀ wa yẹn fún àwọn aláboyún. Mo ní láti kó jọ nítorí àkókò wa.
Bẹ́ẹ̀ni,
But
bẹ́ẹ̀ni.
majorly orí fífọ́ torí bá ti ń fọ́ wa àbí bóyá àyà ń dùn wá, ẹ má jẹ́ ká kàn mú lọ́wọ́ yẹpẹrẹ pé nǹkan kékeré ló ń ṣe mí, ẹ jẹ́ ká lọ sí hospital. Like I said in Yoruba, once we are having severe headache that is not subsiding with rest, chest pain, dizziness, difficulty in breathing, nausea, and feeling like throwing up, let's quickly go to the hospital. We've had several cases whereby people will just think, oh, these are normal things. Probably it could be as a result of stress and they'll stay back home. We've had instances whereby people come in, walk into the hospital with blood pressure of about 200, over 150, over 140, without
serious.
even knowing they are hypertensive. And on coming to the hospital, the first thing we do as nurses is to check their vital sign. And that is when we realize that, no, are you hypertensive? They will tell you, no, I'm not hypertensive, I'm fine.
They are not aware.
Yeah, if they are not careful, a kàn wí pé ẹnìyẹn ní heart attack, ó dẹ̀ gbàbẹ̀ lọ. So that is why that is why we say it all the time, that let us make sure we go for regular medical checkup. We can even have the parameter, the sphygmomanometer at home. A lè máa fúnra wa wò ó. Kíní tó fi ń yẹ blood pressure wò, a lè wá sílé ká máa fúnra wa wò ó, ká béèrè lọ́wọ́ àwọn tó bá mọ̀ wò dáadáa pé ẹ jọ̀ọ́ ṣé ó dá àbí kò healthcare provider ká máa lọ sí hospital fún regular checkup, ìyẹn ní kókó.
Thank you. All right, Ma, thank you so much, Nurse Ibukunlanre. Wow, the time is very, very fast spent, and we've not done so much. However, please, in few words, let's talk about the preventive measure. For it goes in two ways, but let me just speak about one. For people that are not down with hypertension, this high blood pressure, in 1 minute, please, we continue with this show because we still have the adverse effect on people and on pregnant women. All that, we discuss it on the show, and we ensure that we don't leave you with have knowledge on this issue of hypertension, high blood pressure. Let's discuss the preventive measure. What can we do?
Okay. Thank you very much. The preventive measures are almost the same thing as the way we can manage it, like the management of hypertension. So in people who does not have hypertension, who are not hypertensive, I think we need to keep going for or start going for regular checkups. Let us make sure we go for regular checkups. We may develop it and not know it. And that is why they call hypertension a silent killer. People walk around with it, and the next thing you hear is that this person is dead because of heart attack, because of heart failure, because of this, because we don't know we have it. And that is why they call it silent killer. Let us go for regular checkup. Let us do regular exercises. Let's make sure the food we eat, they are healthy, and let's try to look for a way to manage our stress. I know things are not easy at the moment, like in Nigeria, we know that, but let's look for a way to manage our stress. Let's quit smoking. Whoever that is smoking or drinking alcohol, please let us quit, let's quit smoking and drinking. That is the best preventive measure. Thank you.
All right. I'm sorry, we might not be able to continue now. However, I'm speaking on behalf of my guests, which I feel I'm right? Mrs.
Yes.
Ibukun, thank you so much. So we have Mrs. Ibukun Lanre next week on Radio Clinic on Wells Radio 89.3 FM. Please make it a date. Don't have half knowledge. Come on, come hear what all these issues, what this hypertension can lead to. And you won't like to be one of it. You won't like your loved ones, even your enemy. You know, that's how we say it in Yoruba here. You won't wish anybody around you or your loved ones to be a victim of hypertension. And at this end, we draw the curtain for the show today on Radio Clinic. Make it a date next week. That's next Wednesday, by 4 p.m. I'm Kemisola Williams, and I want to appreciate my guest. Thank you so much for the crucial information and your time.
Yeah, thank you, Miss Kemisola.
All right.
God bless you. And thanks to
Amen.
everyone that listens. Yeah. Bless you all.
Thank you so much. Enjoy the rest of the evening. I am Kemisola Williams. Bye.
Without doctors, please.